Good afternoon, everyone. Welcome to part 5 of Best Practices from the Facility Front Lines, co-hosted by Women in Facilities Management, or WIFM, along with its sponsors. This session, we're also very happy to be co-hosting the webinar with the International Facility Managers Association, or IFMA. Special thanks to Maureen Lederer and Ashley Grant from IFMA, our WIFM board, and Ashley Adams, our chapter administrator for WIFM, for helping coordinating all the efforts behind this webinar. WIFM is a 501c3 trade association that began over 10 years ago to advance opportunities for women in FM. WIFM's focused on supporting women to maximize career growth and opportunities in facilities arena. We work closely with other related associations, such as IFMA, and encourage all of our professional members to seek their credentials, such as the FMP, the CFM, and the Pro-FM. At the end of the webinar, we also have some exciting announcements from WIFM about some new initiatives we have. IFMA is the world's largest association for facility management professionals. It supports over 20,000 members in over 100 countries. Speaking of other countries, today we have members from Africa, Portugal, Japan, Canada, and several others. If you'd like to throw your country in the mix, please add it to the chat box and welcome. IFMA's mission is to advance its collective knowledge, value, and growth for facility management professionals to perform at the highest levels. The sponsors for WIFM are national. We'd like to thank them for helping make this possible. Our founding sponsors are Apex Surface Care, Corporate Floors. As our founding sponsors, Platinum is SoftBank Robotics. Our gold sponsor is DPR Construction. Our bronze sponsor is Shaw Contracts and McCloskey's HVAC. A little bit of housekeeping as we go here. We'd like to ask that all attendees remain muted throughout the panel session. Please use the Q&A feature at the bottom of your screen to ask any questions you'd like of the panel. We'll take those questions and we'll add them to the Q&A portion when we get to that from the audience. This meeting is also being recorded, so we'll be posting the video on the WIFM website within a couple of days, along with the transcript. You can check out the WIFM website at www.gowifm.org. So with that, let's introduce our panel and get started. As in our last webinar, our panel is made up of facility management professionals that have national and international responsibilities in their field. These panelists also represent a wide variety of market segments and are considered thought leaders in their area. We're also pleased to have Brittany Fakowski, a partner from Husch Blackwell, join us as our legal expert. I'm going to ask each panel member that they briefly introduce themselves to the group. Aimee, would you like to get us started? Just remember that everybody's on mute.
Hi, my name is Aimee Janousek, and I am the Director of Facilities for VISA's Austin offices. I am also the current president of the board for WIFM. I've got 20 years of experience in facilities management, and I'm pretty sure that I've been on all of the panels up to this point, so I'm happy to be here to keep the continuity going.
Great, thanks, Aimee. Thanks for sharing your journey with us too for this last year. It's been a crazy year. Maria, also a longtime member of WIFM and also a continuing panelist.
Good afternoon, everybody. My name is Maria O'Callaghan. I'm the Senior Director of Operations for the Wharton School at the University of Pennsylvania. I'm in charge of over 1 million square feet in Philadelphia, operations in San Francisco, Beijing, China, and we have a location in Washington, D.C. Just like Aimee, I have been a panelist since the beginning, and it's been quite a journey, and I'm looking forward to the discussion today.
Great, thank you, Maria. Laura Svitak.
Hi, I'm Laura Svitak. I'm president of IFMA's Northern Ohio chapter. I'm a credentialed facility management professional with CHN Housing Partners here in Cleveland, Ohio. I manage a portfolio of 4 commercial facilities in Ohio and Michigan.
Great. Laura, thanks for joining us. And Sierra Knepple.
Hi, I'm Sierra Knepple. I'm a regional facility manager with Plant Moran. I'm also on the Career Services Committee for the Chicago IFMA chapter. I have just over 5 years of experience in facility management. I also have my degree in Facility Management from Ferris State University. And I'm excited to hear everybody's experience and share my experience with the return to office.
Thanks, Sierra, for joining us. Cami Yarbrough couldn't make it with us today. We wish her well, and Brittany Falkowski.
Hi there, my name is Brittany Falkowski. I am a partner at the law firm of Husch Blackwell. I am a labor and employment attorney and have been for about the last 10 or so years, which means that my practice is really focused on helping employers defend claims that are brought against them by their employees, and then also helping employers make sure that they comply with the myriad of laws that they're required to comply with to ensure that they're not discriminating or retaliating against employees unlawfully. Part of that has been advising clients in a lot of different industries over the last year on COVID-19 related issues. And it seems to be that the hot topic these days is definitely vaccination. So I'm sure that we will get to that as time progresses today.
Thanks, Brittany. Certainly some key questions are heading your way today. My name is Thomas Holland. I'll be the facilitator today. I'm the CEO of Corporate Floors and its related family of brands, which includes Apex, APS Property Services, Elevated Cab, and Whitman Global. I'm on the board for WIFM. I'm the board advisor, also on the board for StarNet, and past president of the Dallas-Fort Worth chapter of IFMA. So super glad to be here and looking forward to a great session today. Well, thanks for all the panelists for taking time to join in this and sharing your thoughts on really this truly global issue. I'm going to go ahead and turn off the screen share just to open it up and we can see everybody a little better. The purpose of this webinar is to check back with the panelists that have continued with us from our last webinar in October of last year. The workplace has continued to change in the light of COVID. In our last webinar, we all knew that we were in this for the long haul. We had a lot of great strategic conversation about what the future of the workplace might look like. It was still very unknown as to when office buildings would open. If everybody remembers, last June, the webinar we had was all about returning to office strategies. And lo and behold, the other spike, the summer spike in the virus shut that down. And then we had the winter spike, which shut it down again. Well, today with vaccines rolling out at a prodigious rate, companies now actually starting to implement RTO plans, we think there's light at the end of the tunnel. But we face different challenges today than we thought we were facing last October. And some of those are the potential legal issues around the questions we could ask about vaccinations for employees, vendors, and visitors. Also, how to entice or require employees back to the building that may be hesitant to return, and what's the role of the FM in that. How global supply shortages and delays of key materials may be affecting current projects, their budgets, and your RTO plans. And also confusion emanating from trusted sources that question the relevance of the 6-foot rule that we spent the last almost 14 months putting in place, and also begs the question, just the safety of an enclosed office in general. So I'll be asking the panel some initial questions that were derived from our audience during the registration step for this webinar. We'll then move to a general open session for more audience participation. Again, just a reminder for the audience, please use the Q&A feature. If you've got some questions that you'd like to ask the panel today, now's the time to go ahead and put those in. And again, Ashley will be taking those questions and adding them to the list that will be going here. So panelists, are you ready to begin? Thumbs up. All right, here we go. Well, topic one, now that we're here. So there's confusing statistics about an employee's willingness to return to the office. In one conference board survey, 31% of employees said they were not comfortable returning, and 39% stating they were only moderately comfortable. While in another survey, 75% of executives are comfortable returning. Another survey by the American Psychological Association found that only 49% of adults are uneasy about returning. And yet another survey found over 80% of adults don't want to return. And another survey by the Eden Workplace found that 85% of the workers want to return. So what are we to believe? The fact is there's a big burden being placed on the facility and real estate departments to provide both a real and a perceived safe workplace. So for the panel, the first question, what are the top 3 most impactful things that you feel your company is doing to help returning employees breathe easy when they come back to the office? Who'd like to take that first?
I'll
All right, Aimee.
start. So I think the top 3 things that we are doing are the temperature scans when employees have to come through the front doors. We have a return to office training that everybody's required to take before they come back to the office. And then the signage that we have, just kind of all around the building, reminding people to wash your hands, and here's your desk wipes, and here's your hand sanitizers, and that type of stuff. I think those are probably the biggest things that are helping people feel a little bit more comfortable being in the office.
Great, thank you, Aimee. Would anybody else like to add to that?
I'll add to that.
Okay, Laura.
So along with all of those, right, the PPE, that health screenings, all of that, as your surveys pointed out, there's a wide disparity in who's comfortable and who's not, and some won't have an option. An interesting approach that I found is the yellow and green wristbands, so that everyone can identify and very clearly state what their comfort level is with social distancing. So the green is high fives and handshakes, let's go, I'm comfortable, maybe they're vaccinated. The yellow indicates, they're extra cautious right now, and they're not comfortable being closer than 6 feet. And you can easily identify what someone's feeling without having to ask or get into conversation, ask if they're vaccinated, anything like that. So I thought that was a neat approach.
That's a fantastic idea. You never know if you're going to do this handshake, this fist bump, the elbow, or the foot, right? That's great. Thank you for sharing that. That's the first I've heard of that. Really innovative. Would anybody else like to comment or add to that?
Hi,
Yeah,
Thomas.
I can add.
Oh, go ahead. Go ahead, Sierra. Go ahead.
Okay, yeah, I can add to it. Some of the things that we're doing at Plant Moran, we're actually open at 20% occupancy right now. And I think that some of the things that kind of help people feel safe when they are coming in is, we surveyed everyone to see who wanted to come in and built schedules around that to maintain these occupancy limits. So anyone that's not comfortable coming in, we're not forcing them to. We also have a playbook that we developed that is across our whole firm, and that details all the rules, and it changes periodically based on CDC advice and business decisions. So I think those are really big things. And then also, our daily health checks is every day, whether you're coming into the office or not, you're detailing if you have any symptoms and if you should be coming into the office, whether you've traveled. But I do really love that wristband idea. That's the first I've heard of that as well.
Great. Thanks, Sierra. Maria, you had a couple comments, and if I may say one thing, Maria, before I went ahead and started a poll. One of the tools out there for facility managers are third-party certifications like the GBAC STAR. And so the poll is just simply asking the question, are you implementing GBAC STAR or similar third-party health certifications in an effort to create more peace of mind for your employees? So if you could take a minute, just hit yes or no on the poll. Maria, let me turn it over to you.
Great, thanks. So we have had a percentage of the students back since January of this year. So anyone that was deemed an essential worker and any student that was coming to campus had to be tested weekly for COVID. And in addition, vendors or people that were coming onto campus for just 4 hours, that was our threshold or less, have to do a daily pen open pass, which is basically a questionnaire if how you're feeling, if you have any symptoms. The pen open pass will probably continue, but what we found is that there's a lot of anxiety for the folks that will be coming back in the summer, because right now we've been operating on only essential workers list, but everyone's going to have to start phasing in the summer. So what we're doing is scheduling and working with managers to bring people back slowly so that they won't be in large crowds, maybe even just have a day in the office where they're socially distant to get their desks set up, and also return technology so that there's a comfort level with that too. because a lot of folks brought home their technology when they were working from home. And in an urban environment, they're not going to be parking very near to the building. So we're actually going to have like a welcome tent to allow them to pull up, drop off their technology, and we'll deliver it to their office. So it's a slow reentry process to try to get folks comfortable with coming back. And then there's others, which is the complete other side of the spectrum, that can't wait to get back. And if they could be in there full time today, they would be there for sure. But the other piece that I would recommend is that you are very transparent about your cleaning protocols and your air exchanges with your HVAC system. And a lot of us have done an awful lot of work across many industries to improve those policies with cleaning and also upgrading technology with HVAC. And we should explain that to people so that they have a comfort level that you're doing everything you can to keep them healthy while they're at work.
Thank you, Maria. One thing I think all facility managers can be certain is that all of the returning employees are now experts in viral pathogens. And one thing the advent of the internet has helped is provide information. So we have a very informed group of people that we perhaps didn't have before when we were talking about building cleanliness and health. So certainly everyone's talking almost to their peers now when they're talking about building health instead of a facility employee relationship. Thank you for sharing that. Another question related to that is when you have a team that's all part of a group and they're all working together, and sometimes only part of that team wants to come back, the other part is staying home. So the question would be, how do you juggle the need for a collaborative team culture when the teams are only partially migrated back in your office building? Anybody like to tackle that one?
Okay, I'll tackle that. I think this is a question that's going to be evolving over time, and I think that we're in for a lot of change over the next couple of years. I don't think anybody has a crystal ball and can answer this. I will tell you that a lot of organizations are requesting, especially at the university, that everybody comes back, that there will not be any 100% remote. I think that there's a real challenge with how do you maintain a culture, your corporate culture, your organizational culture, when people don't have those impromptu meetings or just see each other in the hallway or can attend a meeting live. There's something that's missing. But then again, what this pandemic has shown us, that there's definitely positions that in some ways could actually be more productive by working at home and not coming into the office. So I think this is going to be a several-year experiment until organizations feel comfortable with what they're able to handle as far as a mix between work at home and in the office. But I think that we reached a point now where organizations are struggling from the ones that I've spoken to with just the culture itself and being able to communicate in an effective manner when there's a difference. Now, one of the things that I point out is that when the majority of folks are working remotely, that's one set of things. But when you have a larger percentage of people in the workforce, in the office, or in a setting where they're working with their coworkers, and then there's a chunk of folks that are working from home, the dynamic shifts. And that's why I think that this is going to be evolving over the next couple of years.
You're right. I think the concept of the teams itself may change, who needs to be on the team and who needs to be in the office or remote. There was a recent interview of the CEO of JP Morgan Chase, who frankly said, I'm canceling all my Zoom meetings. If you want to talk to me, you need to talk to me in person. Even the CEO of Zoom said he was over-Zoomed and had too many virtual meetings. So there's a time and a place for both. And I think we're all struggling to find that happy balance right now. Well, let me move to the next question. In yet another survey, 25% of returning employees felt that violators of internal COVID safety rules should have harsh punishments, including demotion and or firing. So it's a sensitive workplace right now, probably more sensitive than it's been any time in our work lives. How do you manage the situation where you have returning employees pushing back or simply ignoring company safety protocols? And what is facilities' role in that?
So I'll start with that one. So we have pretty much said that facilities and security is not going to be the police. We're not going to, we're not going to chase people down and force them to put their masks on and things like that. We are going to ask them nicely once, and if they decline to comply with the rule, then we are going to take their name and we're going to call their manager, and we're going to ask their manager to help us explain the importance of this. And if the person doesn't want to comply, then maybe they need to continue to work from home until they're a little bit more comfortable. And if it continues, then at that point we will refer it over to human resources and let employee relations figure out the best way to deal with the employee in the situation so that everybody feels safe. Because if we have one person walking around without a mask, then we have 15 others that they're passing that are wearing their masks, and it's going to make them really nervous. So we start with the manager, and then we'll go on to employee relations if it needs to escalate further.
Thank you, Aimee. Brittany, I'm going to direct a question that's related to you about that. I will remind everybody that Brittany's comments today are not to be construed as legal advice, just perspective. So with that qualifier, when a facility manager, or say someone on the panel or someone in the audience here, is faced with an employee who just simply refuses to follow safety protocols, and Aimee, I think, had some great feedback there of how her company's handling it. Is there any minefields there from a legal perspective or an HR perspective that companies need to consider?
Yeah, absolutely. And I love that I get to go right after Aimee, because I would echo exactly what she said. I think that that's a great approach. The fact that you elevate it to a manager or a supervisor or to human resources, if someone's violating a rule, those are the people who would be able to apply whatever rules you have in place consistently, because anytime you're applying a rule that could ultimately impact a broad swath of people, the key to not running afoul of any discrimination or retaliation laws is truly disciplining consistently. The other piece that I'll just mention is that, what you do have to rely on as employers is that there is a general duty clause under the Occupational Safety and Health Act that requires employers to provide a generally safe workplace. And so if you get pushback from employees on following the measures that you've put in place, measures that are conceivably consistent with what the CDC has indicated should be done in order to prevent transmission and spread of the virus, then you'll be in a good spot. I mean, your position is defensible because you are complying with your general duty to provide that safe workplace. So, in order to not run afoul, follow the CDC guidance, make sure that you're generally doing what you need to do in order to stay up to speed on what the CDC is saying, is best practice right now, because as we've all seen, that's really been evolving.
Great. Thank you, Brittany. Sound advice, sound perspective, I should add. One comment was at UCFF, where they're assigning the compliance control points to the department heads. Initially, the FMs were performing the health screen compliance. So it sounds like people are starting to adapt the correct way there. That's great to hear. I'm going to launch another poll when we move to the next section here. The first poll, just for everybody's information, about 83% of FMs have not yet or are not implementing a STAR or third party, but about 20% are. So good results, and thanks for talking about that. The next poll is going to be talking specifically about vaccines, and I will launch that now. So please go ahead and take your time there. We'll announce the winner there shortly. But the next question is, given the rapid rollout of vaccines, some companies are requiring employees and or contractors and or visitors to provide proof of vaccine before they're allowed back into the office. So Brittany, I'm going to direct a question back to you, and then we'll jump to the FMs here. Again, there's some legal minefields here probably to be considered, and what should FMs be thinking about when somebody, CEO or somebody, comes down and says, we need to have everybody vaccinated before they come into the building?
Yeah, that's a great question. And it's one that I've been getting a lot, as you can probably imagine. So I think, from a broad perspective, there are two things that you really need to be thinking about before you go ahead and mandate vaccination for all of your employees. The first is that employers have an obligation under Title VII and analogous state laws not to discriminate against individuals based on religion. Simultaneously, employers have an obligation under the Americans with Disabilities Act not to discriminate on the basis of disability. Employers also have an obligation to accommodate employees who request reasonable accommodations based on religion or disability in the workplace. So that's kind of the framework. If an employer is going to mandate that an employee get vaccinated, then they have to ensure that there's a process in place for employees who object to vaccination based on religion or disability. And then the employer has to engage in what's called the interactive dialogue to determine whether there's a reasonable accommodation that can be made that will allow an employee to continue working on site. And that comes in the form of a lot of the things that we're already really used to seeing, like a strict masking rule for that person, a frequent COVID-19 testing protocol, making sure that they stay socially distant, those sorts of things. So it's only when an employer determines that an unvaccinated person poses a direct threat, and there's a separate test for that, that cannot be mitigated with a reasonable accommodation, that the employer can then go ahead and exclude that person from the workplace. So it's a high bar. The current EEOC guidance, which that comes from the Equal Employment Opportunity Commission, the agency that's responsible for interpreting these laws, the current guidance is that employees should not be discharged if they, cannot come to work. You should try to find some other, perhaps a remote work arrangement, or, leave them off work for a period of time if there's nothing for them to do at home, because the situation is rapidly evolving. So that's the first thing to kind of keep in mind, is that you've got to have this accommodation process. The second thing to keep in mind is that there are a lot of states right now with pending legislation that would ban both private and or public organizations from requiring people to show proof of vaccination to receive services or enter an area. So far, I think there's just one legislature that has actually passed some legislation that would make it unlawful for private employers to mandate vaccination, and that's Montana. But there are, I think at last count, when I looked, 25 states with pending legislation that would ban mandatory vaccination, either, for your employees or for your visitors, or, for anybody who would be seeking your services or wanting to enter a facility.
Great. Brittany, that's great perspective. Thank you. I just felt like I had a course in the last 5 minutes. So thank you. That was excellent. Directing to the facility managers here on the panel, what are some of the best practices and communications that your teams have put together between HR, facilities, and security, talking about this issue with vaccinations? Because it seems to be a very hot topic and is being brought up. Every customer we talk to is talking about it. So anybody like to share some best practices that you're, or maybe some discussions that are not best practices that just haven't gone well yet in your facility life today?
So we haven't, at this point, we are not requiring vaccinations. It's still, I think, discussions that they're having within the HR arena and legal arena to determine if we can or if it's something we want to do. It's kind of the same with some of the peer companies that I've been on calls with recently in the last month or so. And right now, a lot of us, what we're doing is just sending out communications to employees, just letting them know what their local resources are. If you want to get a vaccine, here are some links where you can go and register to get it and things like that. But we're, at this point, nobody that I've talked to yet is requiring them. Gotcha.
Thanks, Aimee. Would anybody else like to share some best practices or some things that you're talking about internally with your teams?
So I'll echo that. It's not required. We're leaving it up completely to our staff. Same thing, we're sharing all of the resources, locations where you can go and find it, how to get registered within our state, that sort of thing. Another interesting way that I've seen some organizations approaching this is with incentives. Whether it's the time off or a gift card, or I've seen a few different methods for this. And I'm curious to know if anyone else on the panel is seeing this, if they know if it's effective. I'd love the feedback.
I can speak to our company as both a vendor and an employer. We do offer paid time off for people to go get vaccinated. And also as a vendor, we have been asked by two customers now to basically require that all of our employees are vaccinated before returning to the site. So we've left it optional to the employees to report that to us. And then we can't really show proof of vaccination to the customer. We can just attest whether they have or have not, just similar to a background check. So that's how we're handling it ourselves. Real quick on the poll results might help a little bit too with that incentive. 30% of the pollsters said that they were considering or currently offering vaccines to employees directly. So that's actually a higher number than I thought.
So at the university, they do offer vaccinations to the faculty and staff. Our students are required to be vaccinated before they come back to campus next fall. They're going to be required. We are not to ask if people have been vaccinated. If they want to offer it up, we're really not even supposed to accept that information. The incentive is that you got a day off if you wanted to get vaccinated, and they offered them on site. The interesting question that I'm getting, and I've gotten it 3 times in the past 2 days, is from faculty members that were early to the vaccination line and they're scheduling their courses for the fall, and they want to know if the university is going to offer them a booster so that they can continue to teach in person. So like, we're not there yet. So we'll see, but I think there's going to be this is going to be evolving as we re-enter the workplace. But I'd be interested to hear if what the legal ramifications are of even asking someone if they've been vaccinated, and is it best to just not even ask at all. I do know that they said that if you leave the state and you have to come back, if you want to offer up that you've been vaccinated, you don't have to do the quarantining. But at the same time, you're not supposed to ask people if they've traveled either. So it's kind of a catch-22.
Yeah, I think that that's a very conservative approach, just to not ask at all because you don't want the information. And it might be that somebody in your organization is asking the question, but that somebody understands that there are potential minefields associated with the follow-up question, because it's absolutely lawful to ask if someone's been vaccinated. The EEOC, the same agency I mentioned earlier, issued some guidance back in December to kind of help us understand what's okay under the ADA and what's not, because typically the ADA prohibits employers from asking about or from posing medical inquiries to employees unless job related and consistent with business necessity. And so what the EEOC came out and said that's very helpful for employers is that simply asking somebody whether they've been vaccinated is not a medical inquiry at all, because there are lots of reasons why somebody might not be vaccinated. However, and this is where you can kind of step in it, is if you ask the follow-up question of, okay, well, why not? Because that could be a medical inquiry, given that the response in some instances will be because I've got XYZ condition, I have severe allergic reactions or I'm immunocompromised. And so you don't want to be asking those questions unless you have met the test and can ask based on, your analysis of whether it's a job related, consistent with business necessity type inquiry.
Thanks, Brittany, for the follow-up, and Maria for that, setting it up. I know in one city, and I believe it's in Seattle, there's an organization pushing for a third-party provided badge that would show any company in the area that an employee has been vaccinated. So they get one badge by this company, and they can use it in any of the buildings around the Seattle area to show that they've been vaccinated. So whether that's legal or not, I don't know, but that question was, or that process is in discussion, and I know they're actively pursuing that. Not the city, but this third party. Any other ideas or questions from the panel or thoughts that you'd like to share about how your company is either dealing with vaccinations coming in? I know there was a question about visitors specifically that had come up, whether visitors needed to be vaccinated before they were allowed into a building. So would anybody like to comment on what your company's current policy is around that?
So we have a first floor space that's open to the public. We're a nonprofit that serves our community. So we have a number of folks who are facing the digital divide and don't have access to Zoom for virtual meetings and such, or don't have access to a fax machine to send in documents. So they stop by. So we've been open throughout this time. We don't require any vaccines or anything like that, not even for our contractors, but we do the health screening just like we would for our staff. So we're checking, we're checking temperatures, we're giving a questionnaire, we're taking note of who's visiting and so on and so forth in case contact tracing is necessary.
Great. Thank you, Laura. Appreciate that. Well, let me move on to the next question here. And again, I'm going to start this next question set with a poll. We're just going to hit the gamut on different questions, but one of the big ones that's come up is what strategy are you using? This goes out to the entire audience for your company. What return to office? There's generally 3 strategies being discussed. The first one is a hoteling, which is employees can come in, book workstations on an as needed basis, and they have a specific workstation for a specific spot and time. And then the next day they have to book a different one. They're kind of moving throughout the building based on how they're coming into the space. The next one is cohorting, where you have a workstation being shared by 1 or 2 people on a scheduled or rotation basis. So somebody's on an A schedule, somebody's on a B schedule, but they're sharing the same workstation. And then the third is a permanent, where you have a workstation assigned to an employee and that employee always works in that workstation. That's probably most of the norm to pre-COVID, but certainly every company has used all 3 of these throughout the last and are considering which one works well. So I'm going to launch the poll just to ask which ones is your company currently considering here. We'll let this run in the background before we get to the next one. So as a setup to that, this was a question from Jan. Our organization is shifting to a hybrid model for remote in-office work. And what are some examples of employee perks for those that don't have the option to work remote? So if you're giving someone an option to work remote, but they can't do it, are there any perks to give them as an accommodation? She gave the example, they have 2 teams, a maintenance and administrative team. The maintenance team is unable to work remote while the administrative team is, and it's causing some turmoil between the teams. So how are some of y'all addressing that, or have you heard of others addressing that?
I can jump in on that one. We do have that very similar situation where our facilities team is in the office working every day and our administrative team hasn't needed to come back yet. Now, we haven't had any attention about that. I think that we're really lucky in the fact that our facilities team is happy to show up to work every day, but we have made sure that leadership is acknowledging that and constantly, whether it's in their performance reviews or something, and making sure that they know that they're appreciated for what they're doing, that they're going above and beyond. And hopefully we'll see how things go when the administrative staff are expected to come back in, because that might be a different story.
Sure. Thanks for sharing that, Sierra. Would anybody else like to comment on that?
We had for us, it was more of a difference of essential staff versus work from home staff. There's, in some of our locations, we have essential staff that have to be in the office to do their jobs because of the nature of what they have access to. And so what we've been doing since the pandemic began is providing those essential staff members with meals while they're here. So our cafe has been, making breakfast, lunch, and dinner 7 days a week for, whatever essential staff is in the building. So that's been kind of a perk for them to, acknowledge that they may not be able to go out and get something because things may not be open around us or whatever. But as we move towards a return to office and we start to get higher numbers of people coming back voluntarily, we'll likely start phasing that kind of stuff out.
Thank you, Aimee. You just mentioned an interesting point. I'm going to go on an off-script question here related to what you mentioned, but how many of the panelists had cafeterias and kitchens, and what are your plans for starting those back up again, if you are interested in starting them back up again for the returning employees?
So we had a full service cafe here, and because we've been feeding the essential staff, we were able to keep them working, which was a huge thing for us. We were happy to be able to keep them on board, so we didn't lose some really great employees. But what we're going to do for the first 10% that we bring back, we're going to implement an online ordering app. So employees that are coming back will have to order their meals from a preset selection in the app. They pay for their meal on the app, and then they select a delivery time. And the cafe will deliver meals, breakfast and lunch at specific times to specific areas on each floor. We're going to do that to start with, and then it'll probably be, when we get closer to maybe 50% occupancy, then we'll start looking at reopening our coffee bars, and then, you know, more limited offerings from the cafe. But we're going to, until we reach a point where people are more comfortable being in the office and things feel a little bit more normal, we're going to continue to push the app ordering to keep people from queuing up in lines inside the cafe. So it'll probably be fall, maybe early next year, before we actually physically open the cafes for people to visit and pick up their food.
Thanks for sharing that. One campus I was aware of and visited in the Bay Area, even pre-COVID, their employees had the ability to have meals delivered to their workstation, and they were delivered via robot. So the robot went to the cafeteria, they put their meal in that, and that delivered. I could imagine that vendor doing quite well these days with lots of delivery robots. Related to that, any other benefits that are being changed or added to appeal to employees returning to the office? That's a fantastic one, Aimee, for the essential employees to keep them fed while they're working there. What are some of the other incentives that some companies are doing or that you've heard of to appeal to employees returning, to incent them to come back to the building? I think we touched on some of this in the beginning.
Yeah, it's not for us. It's not really a perk, but it's just some of the feedback that I've heard from people that are starting to kind of move through the spaces right now is being able to see people again. Like, that's been a huge, it's not something the company's offering, but it's just, I mean, people are happy to come in and see their coworkers that they haven't seen in a while. And for them, that's enticing to come back to the office.
Got it. Thanks, Aimee. Would anybody else like to comment on that before we move to the next question?
I'll mention just that we don't have full service kitchens, but we have break rooms, and we're moving from the traditional coffee pot to a one-touch, one-serving coffee dispenser for a number of reasons. Better flavor variety, but also it's easier to use, and there's less involved in sharing with each other. Gotcha.
Thank you, Laura, for sharing that. Just the results on the survey should be showing up on everybody's screen there, but about 52% are assigning workstations permanently, about 38% doing hoteling, and about 10% with cohorting. So that's with a little over 100 responses. So pretty good feedback statistically. Let me jump to the next question. This is from Jonathan. What sort of cleaning disinfection protocols are currently being used now that the CDC has released new information about the lack of viral spread via surfaces? We still contract proactive disinfecting when we have an active case, just for peace of mind of the employees. What are their other facility managers doing? Who'd like to comment on that one?
I'll take that one. I think that cleaning protocols still need to be stepped up, especially when you have hoteling space or shared spaces. People are still not comfortable. I think it's extremely important that the housekeeping is visible, especially in high touch areas like door handles, elevator buttons. We use Virex, which is has a dwell time. I think it's 2 minutes as our primary cleaner, but we're not using any kind of crazy electrostatic cleaning or newfangled products. It's just out cleaning constantly on high touched areas. So during normal business, one of our primary buildings gets about 7,000 people through it. I think that we're probably going to be around 4,000 for the fall semester until we reach peak occupancy, most likely in the spring. But that's a lot of people to come through one space on any given day. So I understand that there's not the viral spread necessarily on surfaces, but it's still folks' perception. And I think perception is reality, and people usually, base their comfort level on, Am I hot? Am I cold? Is this place clean? Do I perceive it as being clean? And I think as facilities managers, we're going to have to make sure that our cleaning is very visible and upfront as people try to get a comfort level back into the offices.
Thanks, Maria, for sharing that. Yeah, it's hard to talk about how clean and safe the building is when they walk in and they see dirty bathrooms. One also plug too for those that aren't aware of what the ISSA, the GBAC STAR program is. That's a third-party certification, but they audit all of your cleaning protocols and basically make sure that you've got a very high quality program in place. A lot of companies pass first time around, but it is quite a bit of work to prove all that. And it also contributes a lot to the peace of mind for the employees to know that a third party has come in and actually said, yes, this company in fact does have good cleaning protocols. So one of the questions that came through was how is RTO training implemented? Well, a big part of that training is actually how do you communicate what your cleaning protocols actually are. So going through those third-party programs can add a lot of value to an organization in both ways, both from a training perspective, an operational perspective, and thirdly through a perception perspective. The next question that came up is from Patty. We all talk about the virus being airborne. We spent a lot of money on HVAC upgrades this last year. However, they have no way to really test if those upgrades are making a difference. So what are facility managers doing to provide objective measurements as to the impact their facility improvements have had on the building itself? I think she's talking about specifically either just a general health and wellness or from an actual air quality standpoint.
From an air quality standpoint, at some of our sites where we've implemented things like the ionization and things like that, the UVGA lights, we did air quality studies before and then air quality studies after, and just the comparison of that is enough to show that it does make a difference.
Great, thanks, Amy. Laura, you're shaking your head there. Has your organization done something, or have you had others do something similar?
I think the air quality test is always our go-to, right? You know, if there are questions, if we have sick building syndrome going on and it's running rampant, best thing to do is just to reach out to a contractor or vendor and have an air quality test done. Then you have the facts.
Great, thank you. Anybody else like to add to that?
Absolutely agree. And sharing your filter change schedule, the types of filters that you're using. These all add to peace of mind. And when you talk about air quality and people returning to work, I think you have to also stress that you don't want folks bringing in their own cleaning products from home because they will destroy finishes. Some of them are very toxic, especially if they mix bleach with Fantastic, which we had many years ago. So you want to provide, desk surface wipes, but also get out in front of it and let folks know what the cleaning protocols are before they come in, so that they have a peace of mind that it is being done, right?
Got it. So Maria, we shouldn't bring our Tito's vodka hand sanitizer to the workplace?
I think that one would be fine, but okay. I mean, I will tell you that there has been cases where, especially with hand sanitizer being short in stock, probably last summer and last spring, that there were some pretty toxic things on the market that people were being shipped, and they actually took like terrazzo floor finish off when they dripped. In some facilities. So, I mean, you do have to watch your products. I still think there's going to be a shortage on certain things. So it is important to share, the cleaning protocols. Again, I think that people don't realize the amount of effort that goes into making sure that the facility is healthy for people to return. And once they get that, I think there's a respect that they bring as well. Like, so you don't have 6 people trying to pile into an elevator. Or, perhaps taking off their mask when they're supposed to be masked and walking from their office to the restroom and saying, well, I'm just going from the office to the restroom. When they understand the entire process, I think that it allows people to look towards how they can be the best corporate citizen as well when they're in the office.
Great. Thank you, Maria. give a positive plug for Tito's. During the shortage of sanitizer, they converted a lot of their distilleries to actually produce hand sanitizer, and they gave away a lot of it. So great company, did some nice stuff there. So a great question here from the audience. I'm seeing a difference between being comfortable returning to work and actually wanting to return to work. When offered a hybrid model, you may find more employees saying they are comfortable but may not want to. So how do you approach comfortable versus want?
I feel like those are the people that say, I want to come back to the office, but I only want to come back 1 or 2 days a week. They don't necessarily want to be there every day and interacting with people or different people every day. And I think that those are the ones that we want to talk to them and say, try to understand why they want to come back. Is there something going on at home that they really need to come back, or they want to come back because they want to see people again, and just kind of understanding their reasoning behind it, and then putting together a schedule to make sure that they are really comfortable and that they are going to be okay coming in, Tuesdays and Thursdays, and have other people come in on other days, and just to kind of keep the numbers low. But I think a lot of it comes down to understanding their reasoning for saying that they want to come back, and then how often they want to be here.
Correct. Those would be the people that give the yellow wristband to, right, Laura?
Yeah, and I'll just add, to the extent it's helpful. I mean, I'm getting a lot of questions about this right now because there are people who will say, look, I don't want to come back because I'm anti-vaccination and I live with someone who's high risk, or, I don't want to come back until everybody's vaccinated because I don't think it's safe for me to be there until then. And so we're getting questions at both ends of the spectrum, and we're advising our clients, at least from an HR and employment law perspective, to exactly do what Amy's suggested, get to the heart of the reason why. And then if it is a disability related reason, somebody has a medical condition, they're high risk, they need to, they want to watch their exposure, they want to stay home, they can't get vaccinated, whatever the case may be. If it's health related, engage in that interactive dialogue to see if there's some sort of reasonable accommodation that you can make in order to, to mitigate that concern on their part. Perhaps you can continue allowing them to work from home for the time being. And if it's not something health related, then you don't necessarily have to accommodate.
Great. Thank you, Brittany. Appreciate that. Another question, there are several ways to implement a wellness check. For example, taking temperature, administering a health check-in survey. However, many people are either asymptomatic, so there's no fever, and there's a large segment of the population who simply have to come to work because their livelihood depends on it. And so they may not answer questions on the survey that reference symptoms. There's really no great answer out there. And I would agree with the person who wrote this, but we generally like to get some feedback from the panel on if you've run across that situation before. You have employees that, they have to come back because they need a paycheck. And, either you find out later they didn't answer questions on the survey they should have, or maybe they're trying to bypass the health screening. How are you handling that?
So there's kind of a couple of sides to this. There's the people that intentionally do not answer correctly. It comes back to what Maria said earlier about being a good corporate citizen. I think companies expect their employees to be good corporate citizens and to think about the health and comfort of their fellow coworkers that they're going to come into contact with, and we expect them to be honest. The other side to it is the people who have to come to work, because it's their, that's their livelihood. In those situations, I feel like companies should be working with them to figure out how to accommodate them to work from home, to do their jobs from home, whether it's reassigning them to something else that can be done from home, or just something that will make it so that they're still getting paid, they still have a job, but they don't have to come into the office. And I think it comes down to accommodations, understanding their reasoning behind why they would not tell the truth or whatnot. People that are asymptomatic, there's really not anything you can do about it. I mean, we do everything we can to catch it, but there are inevitably going to be some that slip through.
Yeah.
I mean, if we're doing everything that we can, to keep the buildings clean and keep everybody safe, we do what we can do.
Yeah. we found too that, and there's a large segment of the population that can't work from an office. They have to work with their hands in a building, on a machine, building something, taking something apart. I'd say for the most part, by and large, all of those people are pretty genuine and they're really caring about their impact on others. Everybody else are usually exceptions to the rule. One question too that came up, and this is, I've heard this too, a lot of buildings have been unoccupied for many months, including plumbing systems and cafeterias and water lines not moving through. So Legionella is a real concern. Related to Legionella is also pest control. Lots of varmints and vermin have moved into buildings because there's nobody there to scare them away. So how are you handling Legionella testing in buildings is the question. Related to that, have you stepped up pest control in your buildings?
I think that if you go back to our first and second panel, I had recommended that you don't stop. Even if a building is supposedly mothballed, you still have your extermination come in, you still have your HVAC system checked and maintained all through this. Pour water down the drains, close up ice machines, things like that that are in cafeterias. Make sure that your soda machines, if you have soda machines, have been thoroughly cleaned and shut down because they will rot pipes over time. So if they haven't already been doing that, I would suggest that you start with testing and do a complete maintenance overhaul of your filters, do an air quality test as well, have your pest control management company come in at least 45 days before you start doing significant re-entry into any building. Flushometers in restrooms might not work properly because they haven't been used for a while. So there's an awful lot of checking that has to be done before you can welcome people back.
I think also on top of that, for a lot of commercial buildings, building engineers have been working. So they have been going through the buildings that they're responsible for, even if they're not occupied, and running the water, putting things down the traps, flushing the toilets, shutting down the ice machines. I know we've had people here in the buildings, so our facility staff has been here this whole time, and the guys have just put it on a rotation where they just go through between my team and the building engineers, just going through and doing maintenance of that stuff, making sure that the ice machines were shut off, that the coffee makers are shut off. And then now that we're talking about returning to office here in a couple of months, just with a couple hundred people, now we're starting to go through and restart those things and run them and make sure that everything is working properly. We don't have any leaks or anything like that, just to get things going.
Thanks for sharing that, Aimee. We had one customer who had a horrendous rat problem that came up because all the employees left the building. Well, they left all their snacks inside their file cabinets, the pedestals. And the mice actually ate their way through and started nesting and growing. So they just forgot to check the file drawers for the snacks. So just a helpful hint there, look at those areas.
Yeah, once we realized probably, June of last year that it was probably going to be a little while before people came back, we actually sent our team through and cleaned out all of the snacks. We went through desk drawers, through break rooms, and just pulled all of the snacks out so that we could try to avoid as much of that as possible.
Yeah, and also defrost like personal refrigerators that people have underneath their desks and unplug them. And yes.
Gotcha. Jumping to some of the flex schedules and remote work employee issues. If you offer a flexible schedule or a hybrid schedule, who pays for the chair, desk, or anything needed at home? Now that we're looking at a long-term and not a temporary solution. And is the answer different if the employee chooses not to go back?
So I've seen this a couple different ways depending on the company. Some of the companies people that I've talked to, they have given their employees stipends so that they can purchase a desk and a chair to use at home. Other companies have said, we are only going to provide you with a chair if you have a medical need for it. You have to do an ergonomic assessment, and then we'll provide you with an ergonomic chair or some sort of a sit-stand type setup to use at home, but you have to go through that ergo assessment to get it. And when you come back to the office, you have to bring that stuff back with you. So I've seen it both ways.
Anybody else like to comment on that?
Yeah,
So
I'll just add for the benefit of everybody that there are state laws that impact this issue. And I think your point about do you require it or do you not require it, the work at home, that's an important point because the state laws that I'm aware of, the ones I can think of off the top of my head, for instance, in Illinois and California, if you require somebody to use, you know, a workspace that's at home, or you require them even to use a cell phone that they're paying for, or even internet service that they're paying for, you have an obligation to reimburse under some very specific statutes. So if you have employees who are working remotely in at least Illinois and California, I would encourage you to take a look at those statutes and make sure that you're complying with those requirements. And then, you know, assess whether a policy should be more broadly applied to your workforce if you're also operating in other states.
There's also the consideration for other countries, because some countries there's tax implications if you provide employees with furniture and stuff to use at home.
Thank you both for that. Bria?
Well, I was just going to say the University of Pennsylvania made a decision not to provide work from home furniture. You did get to bring home technology, whether it was your monitors or you got a laptop. But what we did in the Wharton School specifically is we partnered with a local furniture distributor and came up with a couple of different options for desks or sit to stand options or ergonomic seating. And they were at a deep discount, and they actually shipped them directly to people's homes. And they gave a deep discount for people that might live on a third floor apartment and they had to have the boxes brought up or to have something put together. Because the furniture vendors were also hurting at the time. And this was a great bridge. And we continue that program today, and a lot of people took advantage of it. You're talking about discounts that we were able to secure that are 75%, if not 80% off a list.
That's terrific. Thanks for sharing that. Related to that question, what do you do when you have two people who are sharing a space? If you get back to those that are coming back to more of a hoteling, or a hybrid, what do you do when two people are sharing a space but they have different ergonomic needs?
So I would recommend having just a standard ergonomic setup where all of the equipment is available, the sit stand, the monitor arms, the keyboard tray, and then probably the only difference would be the type of chair. So each individual may need a different kind of chair. And what we would do is just have both chairs there in that area available, and then they grab the one that they need. You know, whoever's there that day grabs the one they need.
Thank you, Amy. Anybody else want to add to that? All right. Another question on returning back regarding safe distancing. What are FMs doing with bathrooms, and I would add elevators, in terms of spacing and safe distancing, especially if that bathroom might be on a shared floor?
So we've gone through. Go ahead, Sierra.
What's here?
Yeah, we have occupancy limits and we have signage up on our restrooms to indicate that it should only be two people in a space. Elevators is something similar, and really having that signage everywhere visible to people is extremely important because they might be aware of the rules, but they need a reminder when they're actually in the space.
All right, thank you. So occupancy limits seem to be the answer to both the bathroom and the elevator question. Got it. Another question that came up, and we've seen this too, in companies encountering employees who say they cannot come back to work because they have childcare issues. So how is that being communicated to the HR and those facilities really being part of that conversation, or is that really between the employee and their supervisor?
For us, it's between the employee and their supervisor. I mean, it really comes down to that, you know, figuring out why they can't come back and making accommodations for them wherever they can.
Yeah.
Same for us, and we'd defer to HR in those instances. But as a mother, I can appreciate that difficulty.
Yes.
Yeah, we have an implementations team that helps that helps with that too.
Yeah, and we're getting a lot of these questions too, because I don't think it's a secret. If you look at the news cycle, seems to be an article almost every day talking about how the pandemic has negatively impacted women in the workplace and that women tend to be the primary caregivers. And so one thing that I think is, interesting to think about and helpful to think about is that the EEOC, again, that agency that I mentioned earlier, they held a hearing, I think last week, just really kind of trying to understand more about how these return to work issues might negatively impact people who are already sort of marginalized in our society. And one of the questions that the new chair of the EEOC was asking was a lot about how employers' policies could have a disparate impact on various groups. And in particular, people who are older, who suffer from COVID-19 or at, a disparate rate. Women, in particular, Black and Latina women, and also, individuals who have disabilities. And so the EEOC is going to be looking really closely at how employers are tackling return to work and seeing whether these policies have a disparate impact. So, you don't mean to treat somebody in a discriminatory way, but it just so happens that the impact of the policy results in a disparate discriminatory impact. So just something to keep in mind as you're kind of looking at how your return to work policies are going to impact different segments of your employee population.
Thank you. Yeah, a lot of single parents have been tremendously impacted in this last year. Brittany, this back to you, if I could please. A couple of questions that come back asking for some clarification about vaccination. And again, just looking for your perspective here. Two questions, back to asking a visitor or employee if they've been vaccinated. It was stated that under the ADA, there was support for this question being lawful. And is this consistent with what HIPAA would protect? And then related to that, can you talk more about a person's right to not share if they're vaccinated or not, if there's no federal mandate to disclose this information? So I think there's just some confusion again around, what is legal and what is not legal to share. Could you clarify, please?
Yeah, so I'm not a HIPAA expert, but I do know that HIPAA doesn't apply quite as broadly as most people think it does. It applies to certain healthcare providers, and healthcare providers aren't permitted to share medical information unless they're authorized to do so. I mean, that's kind of the baseline understanding of HIPAA that I have. So if you are not one of those entities that's covered by HIPAA, if you are an employer and you operate in food manufacturing, then you're not going to be subject to HIPAA's rules that you maintain the confidentiality of medical information under HIPAA. There are separate privacy laws that could apply, and there are definitely reasons why employers want to maintain their employees' medical information that they gather as confidential, because of common law right to privacy, and also because there are just other separate requirements under the ADA to maintain certain medical information as private. What I was saying about vaccination status and what the EEOC has come out and said is that your vaccination status is not a medical inquiry. It's not medical information, because there's you could choose to get vaccinated for a variety of different reasons. And so simply asking somebody whether they've been vaccinated is not a prohibited medical inquiry under the ADA. And I hope that's clear. The other question about, look, do people have a right not to share if they're vaccinated when there's no federal mandate to disclose this information? There is no federal mandate, and a lot of states, like I said earlier, are weighing in on whether you can take some sort of adverse action based on somebody's vaccination status. But just because there's not a federal, I guess there's some federal silence in this area, there's nothing prohibiting employers from asking their employees if they've been vaccinated or not. And the EEOC has been really clear on that.
That's great to hear. Thank you. Anybody have any other questions on the panel or any comments about that? All right. Quick question. Are facility managers still setting one-way hallways? And has that been effective in your building? We've seen that in quite a few buildings.
So I think that really depends on your office layout, right? If you have a very large open workspace, it may not be necessary. If you're still managing a facility that's using a maze of cubicles, however, it's probably going to be helpful to note which way's the best to get around. And you could do that easily with wayfinding stickers, and there's lots of affordable options to manage that. So I think it really just depends on your facility type.
Aimee, if I may point a question to you, somewhat related to this. You had mentioned earlier when we were talking about things that you're doing to provide peace of mind for returning employees, and signage was something that you mentioned. Have you found one sort of signage more effective than another, and kind of how are you employing that sort of signage in the workspace?
So we have new signage all over the place. Probably what's going to stand out the most to people is we've actually placed round stickers on the floor at the lobby desk that say, please wait here, and outside of the elevators that say, please wait here. Inside the elevators and in the restrooms, please stand here. So we put them in the corners of the elevators and in the restrooms, every other sink. We didn't close off any of the stalls because our stalls are full height walls and full height doors. So they're private. So we didn't close any of those off. And then the signage all over the conference rooms and the huddle rooms that say, maximum occupancy, and we've cut it in half. So if there's, 16 chairs in there, it's a maximum occupancy of 8. And then we went and put bags over the chairs that could not be used, and an X on the table in front of those chairs, just to reinforce that we want you guys, if, when the time comes for us to reopen those rooms, we want them to be a seat away from each other to begin with.
Thank you.
We also, wherever we have hand sanitizers and desk wipes, there's signs on those stands that also say, this is here for your use. Please use hand sanitizer. Please wipe your desk down. Things like that.
Thank you. Any other examples of signage that the rest of the panel has found helpful for your employees?
I've
Not
found
necessarily. Oh, go ahead.
I've found that with the signage, we're all being overwhelmed with signage right now. So one thing to be really mindful of is what signage do you have up that's necessary, and what signage can you take down so that you're getting the most impact out of what you have up that's critical. So yeah, if you've got a lot of labels and signs everywhere, it might be time to take some of those down and just stick to the necessary essential signs for now.
Thanks, Laura. Good advice. Sierra, you were about to mention something?
Yeah, not necessarily signage, but we use a reservation system to book your seat for the day. And we do have those spaced out. So rather than, physically blocking an area off, you go into the system and it's spaced out, socially distanced. So I think that's an alternative to signage. It's also effective, but like Laura said, you avoid that overloading of signage when you come into the space.
Thank you. There was a question, if you don't mind sharing, Sierra, what reservation system y'all use?
We use Agile Quest.
Thank you. Getting back to another vaccination question, Brittany, I've heard this asked before, and I think it applies to a specific state you've mentioned before. But if a company mandates the vaccine, then this person's understanding is that the company becomes responsible if they have a negative reaction to the vaccine that needs to be covered under the workers' comp policy as it becomes a workplace incident. And that's also included on the company's OSHA accident report. Can you provide any feedback or perspective on that?
Yeah, so this is going to depend on state law because each state has its own workers' compensation system. But by and large, I think it's fairly safe to say that if you mandate the vaccine and someone experiences an adverse reaction to it, then it could be a workers' compensation event and it would be a claim. Similarly, the OSHA record keeping issue is one to keep an eye on. OSHA did issue some guidance not too long ago that confirmed if someone experiences an adverse reaction, then you would have to record it on your OSHA 300 log if you mandate the vaccine. So you want to keep track of both your federal OSHA requirements, but then also there are state law OSHA requirements as well. And I am not like a safety and health expert. We have those experts at our firm, and they probably know that information right off the top of their heads. But I know enough to know that you will have to look into that and make sure that you're complying.
Thank you. Thanks for the perspective. Another question for the panel, and then what we'll do here is we'll jump to the wrap-up question that we have for everybody. There's been a lot of enthusiasm for a lot of people to come back to the office as well. It was mentioned before that just being around people, it's what us humans do, it's what we love to do. So with that enthusiasm, sometimes groups get a little too enthusiastic and want to get too many people in a room, maybe too soon for some. So how do you deal with coming back to the office and everyone wants team lunches sitting 40 people or more? Is this something they should wait on for a bit or jump right back into normal because they're allowing coming back to work? So how is your company addressing those situations?
From a company perspective, we are still encouraging people to use virtual platforms to get together with their employees. We don't want them gathering, whether it's outside the office or inside the office in any official capacity right now.
Gotcha. Thank you, Aimee.
Here, same here at the university. Yeah. And any gathering has to be approved from a higher level at the provost level. That's both from a student and a faculty perspective. So there is outdoor seating, but it's socially distant, and they still require 10 feet. So you have business set of rules, and then you have college and university set of rules. And so the college and university is actually a little bit more stringent than even the business side. The interesting thing will be when states start lifting a lot of the COVID mandates, and that'll probably come June through the end of the summer. And then you're probably going to have a backup plan, because we're going to be taking those signs down and what do you do? What's your plan B if there's a spike, right? Because you're not going to want to reinvent the wheel. So it'll be interesting to see. Maybe our next panel discussion will be what is everybody's plan B as we move forward with reentry. But I think it's ever evolving. But meeting in groups, you have to follow whatever your state mandate is in your city that you're participating in, and almost all of them still have, at least in the Northeast, some sort of a mandate that you can't eat in large groups like that.
Thank you, Maria. What I've heard today from the panel, there's a few key words that stand out. One of them is transparency, and that's companies being very transparent about what they're doing with their cleaning and safety protocols, and being very transparent with the employees returning, because every returning employee is somewhat of an expert these days in cleanliness. The other was being current. And Laura, you had some great feedback of just making sure that, because there's so much information coming so fast, and you put up a sign today and it's outdated next week, and making sure that we're staying current with that information. And the last thing that I heard a lot from Brittany was just being informed about your local ordinances, your local state laws, because one facility manager in Ohio does it one way doesn't mean that that's done that way in California, and vice versa. So being very aware of that and relying upon the teams that you have in your company to look into those things. The last question we have for the panel here today in closing is, again, what I like to call the crystal ball question. So what I'd like to ask each panelist is to give us your 30-second, 60-second thought on what you think are the most important tasks that you'll be focused on over the next 3 to 6 months. And as part of that, what hurdles do you feel are still ahead of you? What obstacles do you think that you can't quite see around the corner yet and that you might have some worry about? So I'm going to go around in order here. Maria, I'm going to pick on you if that's okay. So I'll ask you first if that's all right. So if you could give your 30-second thought on what do you think are the most important tasks are ahead of you in the next 3 to 6 months? And also, what hurdles do you feel are still ahead of you during that time?
I think the most important tasks is getting people comfortable to return to work, and making sure that it's a safe environment, and making sure that the staff, especially a lot of the cleaners and maintenance teams, the full maintenance team, because we've been working with lower staff, are fully trained and been reintroduced to the environment. so that they have a comfort level as well. And then just being, I mean, this kind of sounds corny, but being very flexible, being able to roll with the punches, because I think that this is uncharted territory, and making sure that facilities still has a primary seat at the table, which I think we didn't have before. And we've discussed this in past panels that, the pandemic has kind of put us front and center, and we need to remain there moving forward so that we can be proactive instead of reactive when emergencies come up like this pandemic.
That's right. Thank you for sharing that. Sierra, I'm going to jump to you here.
Yeah, I think, a big focus for us is going to be how to entice people back into the office as we increase our capacity limits. A lot of people might still choose to work from home because it's more convenient. And we're a big culture company, so how can we get people back in the office in a safe way and make it more enjoyable for them to be here? And then a big challenge, especially in my Chicago office, is public transit and how to regulate that and make people still feel comfortable coming into the office, but how can they get here if driving's not an option for them?
Thank you, Laura. Thank you, Sierra. I was on mute myself. Laura, would you mind going next, please?
Sure. So, we're preparing for and hoping for, pretty close to full reoccupancy in the next several months. I think one of our biggest challenges is transitioning from a traditional office setup to hoteling and a variety of meeting spaces for our clients and our teams that have very different needs when they're meeting with their clients. So that's going to be difficult for us, but we're already working on it. And yeah, I mean, we're going to run into challenges. It's going to be an adventure, but we'll roll with the punches, like Maria said. And yeah, I think overall, we're just really excited to seeing our buildings back in action.
Great. I love the enthusiasm. Isn't that the middle name of a facility manager? Roll with the punches. Aimee, how about you?
So for the next 3 to 6 months, we're really focused on return to office and getting outside of the essential staff we've already got here, getting this first 10% in, kind of testing out the things that we put in place, making sure that everybody's comfortable with them, making changes where the employees give us feedback, where they say things that they like or they don't like, and then slowly ramping that up over the summer. And then hopefully in the fall, having a higher occupancy in the buildings and a little bit more opening. We're going to start out with assigned seats for the first group here in Austin. It's going to be a little different at each site based on who they have working and how many people are coming back. But for us specifically, we're going to have assigned seats to start with. But then by the time fall comes around and we start bringing in more people, we're going to start transitioning to free address. A couple of our teams were already sitting in free address before the pandemic, so they know how it works and they're going to be used to it. But the majority of our staff was in assigned seats, and it's going to be a change for them. So the hurdle for us is going to be getting through that change management process and setting the expectations for the higher numbers of people coming back that are not used to that free address situation, and making sure that they all understand that yes, you may be sharing desks technically throughout, the week or the month or whatever, but those desks are cleaned every night, and making sure that they are comfortable with our cleaning processes to know that we're just going to continue to do everything we can to keep them safe. You're on mute again, Thomas.
Thank you. You remind myself. I have a sign right here on my screen. Do not put yourself on mute. Brittany, you've got a unique perspective of being both a building occupant and also the legal analyst today. So coming at it with both hats on, what do you see as the challenges for this group here, both as the occupants of the building, but also from a legal perspective, and interested in that?
Yeah, I think that you guys have a real challenge and a high task, just especially as things evolve, because I see over the next 3 to 6 months, the science really evolving and telling us more about vaccinated individuals, and there being more and more CDC guidance about people getting together. I know my clients are already asking me, can we just get all the vaccinated people in a room and throw away our masks? Everybody's just dying to get back together. But then there are obviously going to be people who, you've all mentioned comfortability, and there are going to be people who have all different kinds of comfort levels. And so I think that the challenge is going to be making sure that you are listening to everybody, and you can't please everybody, but doing your best to be empathetic during this time. I think that employers are really being looked to be a leader in that space during the pandemic especially. And so I'm sure that you guys see that as part of your role as well, just making sure that everybody gets a comfort level, and you can show that you're following the latest and greatest when it comes to whatever guidance is coming your way.
Thank you very much, Brittany. Well, we'd certainly love to thank our panel for participating and sharing your thoughts and feedback with so many of your peers. Special thanks to the WIFM board, and also thanks to IFMA for co-hosting this webinar. Thanking our panel again, Aimee Janousek, Facilities Director at Visa, Maria Callahan-Cassidy, Senior Director of Operations, the Wharton Business School of Pennsylvania, Laura Svitak, Facility Manager for CHN Housing, Sierra Knepple, with Regional Facilities Manager. Cami Yarbrough wasn't able to make it with us today. Brittany Falkowski, our legal analyst and partner at Husch Blackwell. And my name is Thomas Holland. Also assisting me today was Ashley Adams, our amazing WIFM Facility Administrator. WIFM is supported nationally by our sponsors, Apex Corporate Floors, SoftBank Robotics, DPR Construction, Shaw Contract, and McCloskey's. Most importantly, we'd love to thank you, the audience, for taking your time to sharpen your saw and share your questions, which will help so many of your peers. Some really great questions asked today. We'll be taking all of these and taking the transcript. We break the transcript down into the questions and answers, and we'll be posting all of that on the WIFM website, as well as the recording. Upon exiting the meeting, you should also be presented with a short survey. We'd love your input on that so we can continue to improve these webinars. Two last quick announcements regarding WIFM. We're happy to announce our first in-person meeting is going to be this month, May, on the 20th in Houston, Texas. So you can go to the WIFM website to find out more information. The invitations will be sent out tomorrow morning for registration. And lastly, we're also proud to announce we have a scholarship program that we're rolling out to empower members to advance their industry knowledge and skills. The scholarship recipients will receive a fully funded education experience to obtain one of the certifications or credentials from IFMA or Pro-FM, including a FMP, a CFM, or Pro-FM credential. The application will be listed on our website, and an email will be sent out on Monday with the full details, so be sure to look for that. So again, thank you so much for joining us today. Until we can speak again, I hope everyone stays safe and healthy. God bless and good day.